Welcome to the Hospice Veteran Partnership meeting and our presentation on moral injury. We're so grateful to have Giovanna Meek here with us to present about moral injury. Giovanna is a chaplain for hospice and also a veteran. So thank you so much for sharing your time and expertise with us today, Giovanna.
You're welcome. It's my pleasure. Being part of this group has been on so many levels important to me. It's been like a support group to be able to come, even though I don't live near any of you, and we are all from different organizations. It is so good for my spirit and for me to be able to come together, in addition to all of the education and learning that I receive here, just like the update that you just provided to us is something that I am not keeping up on those types of things. So thank you so much to all of you. I am just sharing things today from my experience and from my own education. And so I am doing this as a colleague of all of you who are out there to care for those
She's unloading.
who are in need. And that can be in many different ways. And I know we are usually focused on veterans. That will be a big part of my presentation today. But moral injury does not just apply to veterans. So we'll have a little bit more expansive. We're going to give this a shot and see if I can share a presentation from my end. Let me know. I'm going to need to know what you're seeing in order to know if this is
It says that you've started sharing your screen, but it's blank.
okay. Let's see if it starts to
It's
be.
there. We see the moral injury understanding and healing slide.
Let's see if it's in presentation mode because I don't see what you guys see and I don't see all of you.
It's in presentation mode. Hmm.
Okay. So I will just let you, as we go through this, please just interrupt me. First of all, for everyone who is part of this live, if you have any questions along the way, if you have, and I will ask some questions and ask for participation, but please just feel free to interrupt me. And Becky, if you see, I don't see any chats or anything like that, so please pass those on.
I'll
Um,
monitor the chat for you.
Okay, thank you. It would be wonderful for this to be interactive. So again, I am sharing what is my experience and what is my education that I have had regarding moral injury. Today, I speak to you all as people who would like to potentially come alongside and be part of the healing journey for people who have moral injury. So our focus today is to gain some understanding of moral injury, and then to see how you might be interested and how you might be able to walk alongside those who might begin or be already in their healing journey. So we're going to do just some basics of understanding the 5 Ws. It's an easy way, at least, to get things started. We'll talk about some of the symptoms or some of the things that might be apparent for someone with moral injury. And then we'll move on to the healing aspect and what it might be like if you are to consider walking with the wounded. And again, this presentation is not meant to make you someone who is an expert at moral injury. This presentation is intended to be heard by people, anyone. It could be anyone. It could be somebody who is just a sister, a layperson, someone who knows nothing about the military, anyone who might be interested in learning more about moral injury or walking with those who need to heal. In other words, I'm not talking to you as professionals, PhDs, and I don't expect you to come out of this thinking that you have everything squared away about moral injury. Every single person on this earth has the ability to help someone who has moral injury. So the first question is, what is moral injury? And you might have heard a lot of different definitions of moral injury because there are a lot of different definitions of moral injury right now. The one I'm giving to you here is the damage done when a person perpetrates, witnesses, or fails to prevent acts that transgress one's own moral beliefs, values, or ethical codes of conduct. There is a lot in there. go ahead and take a look at it yourself. You can see that it deals with either acts of commission or acts of omission or just witnessing something that does not square with someone's foundational understanding of the world, of their values, maybe of their spirituality. In other words, another way I would put it is it's the damage or injury or harm, that's the wound that is done someone's conscience, their moral compass, or their soul. So each one of us, we've got this like heart center of, some people call it their conscience. Some people say, I've got this moral compass. It's about what is right and wrong. How does the world work? And how do I fit in it? And there are people self-identify that concept. It's a foundation. It's a foundation of who we are. And it is heavily influenced by our society or our culture, what we grow up with. I mean, even here, normally when I can see all of you, there are anywhere from 10 to 30 or 40 people here. Every single one of us grew up in a different type of family culture, a different society. Even if we are all Americans, we may find ourselves when we become adults and we encounter a situation. I'm not even talking about moral injury here. We will have a different opinion about what might be right or wrong, or what might be offensive or not offensive. We experience that. That's table conversation these days in America. What is offensive to someone? What isn't offensive? This all has to do with what is our foundational concept of what is right and wrong. And that's why I present one's conscience, moral compass, or soul. That last word, soul, it's the space, the spirit, the soul, without getting into details about that. That's the space that I, as a chaplain and a lot of people who are spiritual care providers, that's the space we live in. And so another way to think of moral injury is injury to that moral foundation or injury to the soul, injury to the conscience. It's that core that holds you together, and that has been injured. So we might call that a wound to the soul or a soul wound. And that is not uncommon. All of these terms are used by different professionals in the arena of moral injury. So I'm presenting to you here a few more definitions by some leaders in the realm of moral injury. The first one's from the VA. And since what brings us together is our care for veterans and our desire to serve them, an act of serious transgression that leads to serious inner conflict. Again, that's in that compass, that's in that inner soul, because that experience is at odds with core ethical and moral beliefs. The second one talks a little bit more about the soul. You'll see words in here, ethics, ideals. He has the word attachments. So again, that center core of us, you can think of it either as a foundation that is strong and you are built upon it as part of the fabric of who you are, or you can think about it as that heart center core of, it includes, what are your ethics? What are your ideals? What are your values? What are your beliefs? What are your attachments? Moral beliefs, expectations. You can see some of the words that are used here. I like the last one by Brock and Latini, souls in anguish. So this is not a psychological disorder. And when we talk about veterans, veterans struggle with a lost sense of humanity. That can happen after transgressing these deeply held moral beliefs. So mentioned right there is that it's not a psychological disorder. It's a key thing to remember. It's very, very important in the larger scheme of thinking about moral injury. And we'll talk about the difference between PTSD and moral injury later, but it's not considered a psychological disorder. This is something that anyone can experience. And it is actually an understandable, normal response to something as opposed to a disordered response. So someone with moral injury doesn't have something wrong with them. Just like if you go and you fall and cut your knee and you've got that wound, it doesn't mean there's something wrong with you as a person. It means you have a wound. Yet that person with moral injury is so hurt by that wound, they often think they do have something wrong with them. We'll get into this a little bit later. All right, next. Here's another one of our 5 Ws. There's a long history to the concept of moral injury. And even though it wasn't really clinically sort of defined until the 90s, there's always been a recognition that soldiers and veterans experience moral injury quite often from wartime, from battle. And it's been modern day, really post 9/11, that we have recognized that we have people coming back from the modern engagements this century who are experiencing something that is called moral injury. And that's what brought attention to Vietnam era veterans and those who are really on our hospice services who have moral injury and it's never been attended to. But modern day and alive very much today in the conversation about moral injury, it's not just about veterans who might experience it, people who are in the military or still are in the military, but it is also first responders and healthcare workers. It became a really live conversation, really in the midst of COVID-19. A lot of the, let me step back just a minute. A lot of nascent research in the modern conversation about moral injury was happening earlier this century, just before 2010, before the tens. I forget what the aughts. I guess it was during the aughts. There was some really good research starting to be done by people who are in academia and in mental health, by a few people. And so by the time we got to the COVID-19 era, and a lot of that research was being done that was pertaining to veterans. By the time we got to the COVID-19 era, there was an awareness that moral injury exists and we should pay attention to it more. And they started to see it in healthcare workers. So when we are people working in hospice, palliative care, home care, not only are we in this group caring about veterans, but we are constantly working with our colleagues. And I'll remind you, all of you are in healthcare as well. And first responders have, been around for a long time. So this is not something that is new. It's just that there's increased interest and research that is happening right now. And that is something that is going to serve all of these people well and really serve humanity well. My proposal is that this moral injury concept has been around since the dawn of civilization. As long as there are humans and there are things that transgress what we believe are our values and our ethics, there is the potential for moral injury. So this is really something that has occurred throughout human history, and we are just starting in modern day to put words to it, to start pay attention to it, and to learn how to help people with it. So this leads us to the way that I think about us, and probably so many of you do, which is the human is both body and soul. We can get an injury on our knee, scratch our knee, that's a wound. Oh, we're immediately on it. We are, oh, do you need a Band-Aid? Oh, it's oozing, it's bleeding. Can I fix it up for you? But we are body and soul together, and the soul can be injured as well. So we need to, when you think of moral injury, you can think of it, here's the bloody knee or the banged up knee, even on a little kid. The same kind of thing can happen. This invisible, what seems like an invisible wound in the soul can happen. And that's what we're talking about as a moral injury. Think about that bloody knee. There's some sort of trauma you experienced, and that's what causes the wound. For moral injury, the soul experiences some sort of trauma. and that's what causes a wound. I'm trying to put this in very simple terms. You're human, you have a soul. If there is some sort of trauma, it might be in your body, it might be in your soul. This is a moral injury. Who does this happen to and where does it happen? Military, on the battlefield. Again, it does not necessarily have to be something that happens, let's say, in Vietnam. I think for a lot of us, we can imagine some of the things that were experienced in Vietnam, or we've heard for ourselves or read things. And we can imagine how someone might have experienced serious moral wounds and moral injury from Vietnam, or people who have been overseas in the current conflicts. But this can also happen on the home front here in America for military personnel. And I want to add that it can happen virtually. We will get into some examples of this, but I'll just, in case that virtual part, let me just make that a little more clear. We have service members, of course, who have always served in the United States, but their reach is worldwide. So in the Air Force or for nuclear wartime, we have people who you imagine them underground in these missile silos and they've got their finger on the button. I'm trying to make light of something very serious, but there are people who are in the United States and they have the ability to have a far-reaching effect on people who aren't here. This virtual space, and that's been going on for a long time about finger on the button, nuclear weapons, that type of stuff, or ICBMs. But what we started using very actively this century is virtual, what I call virtual operations. You will be able to picture this when you think of drone operators. So we have drone operators that are located in the United States. They're also overseas as well, but you could be we have service members who may be 22 years old, maybe even younger, and they are sitting in Nevada. They come to work every day. They might be on a shift. They come and they operate a drone, and during wartime engagement, they will be dropping ordnance or firing on someone. They may or may not ever be able to clearly see who has been killed or who has been wounded. And I just want to give that example of that's what I mean by virtual. We now have kids growing up that are killing people on video games all the time. It's very common for them. It's very different when those kids become late teens, early 20s. They join the military. Let's say they become a drone operator. And can you imagine what starts to happen? They start to realize the seriousness of this and start to think about what am I doing? It's very different to be sitting and operating a drone home side in Nevada as compared to being on the ground and having the entire, totally geared up, going into war zones or into battle and having all that comes with that, which is adrenaline, which is fear, which is physically readying yourself for defending yourself when you might need to defend yourself or might end up having to kill someone. It's a very different experience for a military person than operating a drone. But my point is that moral injury can happen to both of them. So again, that's foreign, domestic, and virtual for military personnel.
Giovanna, can I ask a question real quick?
Yes.
Um, I really appreciate you bringing that up because that is definitely an unseen place. I didn't realize or think about that people could be stationed here in the United States in a somewhat safe environment and have the ability to um, hurt people and not ever know. I'm
Mhm.
curious, is there anything in place? Like, is that it sounds, I'm just a little blown away. Like, so they could show up to a shift and
Mhm.
potentially drop a bomb or do something that could harm others following orders. And then just go to Starbucks on their way home and have it would be an everyday thing? Or is there something in place when people have those kind of jobs to provide that support and even camaraderie that someone might have actually serving physically in combat? Does that make sense?
Hmm. Absolutely. I've worked very closely with drone operators ever since shortly after 9/11. And so I'm familiar with that space. I will give a very short answer relatively, but if anyone would like to talk further about this sometime offline, I would be happy to. So when this first started, there wasn't a lot of support. Yes, is there camaraderie? There's the camaraderie of, going in and, being with your unit that's in a more of a computer sort of operations center type of environment. So there is some camaraderie. There is that. Yes, they are coming from home. They're going back to their life, which may be family, or for some of the young guys that it means, going out later and having a good time. So the military is getting better, but it really has been the VA that has been leading the way to identify that this type of thing can exist. Um, and so I am not currently in those spaces anymore. I completely trust that there are good leaders out there who are attending to this. But as we all know, our job when I was, the military's job is to defend and protect. And in that job, that may be to be a war fighter. So the job of the military is not to figure out, um, it's to make that war fighter the best war fighter he or she can be. And so we would all argue who are here, well, that would entail, how about we have some things in place that are really supportive for this type of thing? I want to parallel your question and my example of a drone operator with a healthcare worker. Because for those of us sort of in this space of thinking about veterans and military, we think, oh, wow, there are people who just go to work and they might have to do something. And it's not just someone's life may end, and we often say because they were following orders, for everyone in the military, it's not just that we're following orders. We have, you know, codes and ethics and rules of engagement and everything that we have built the way we operate to be as safe as possible for ourselves to only end up wounding or taking a life, even if it's an enemy combatant, when it absolutely is necessary. And so, yes, there are people who are at home, go to work, they're essentially in an operations center, and that type of thing may happen. But guess what? That is exactly how healthcare workers are every single day. And you can sort of parallel that to the COVID-19 epidemic. Remember, and maybe some of you who are watching this right now were one of those people. You would be at home with your family, go to work. Healthcare workers, thinking about it within a pandemic is really easy. They go to work, they're risking, remember the time when you felt with all the knowledge we had, you were risking your own life and you were potentially risking the life of your family when you potentially brought it back home. But when you went to work, you may have been making decisions about what type of treatment someone should or should not be given, and someone's life could end right in that day, and they go right back to work the next day. So this concept of living at home, dealing with life and death situations and going back home is actually something that first responders and health care workers deal with every day. So I like to give that as a little bit of a parallel so that we can see there are people around us all the time who are engaging in decisions and actions that might affect, it's not just about life or death, but might affect their code of ethics. And we'll get into some more examples in just a little bit. I also have a couple other categories of people on this slide. One is criminals. That may seem pretty obvious when we say it, like, well, yeah. Can you imagine how many people we have who are in jail or prison right now, reflecting back on what they might have done, whatever it may have been, and realizing that they transgressed their own personal values, or they didn't know they had them before, but they have them now? And anyone in authority, I mean, any of us, if I've already said any human can incur a moral injury or a soul wound. But these categories of people are primed to because of the nature of what they're doing. So anyone in authority is making decisions that affect other people. And where this happens isn't just the battlefield. That list shows that there's a lot of different places that this can happen. Part of what I'm wanting to point out here is a little bit about, when you stub your toe, you fall and you hit your knee, blood comes, you know you have a wound, you try to attend to it right there. The time space experience is right, the wound happens and you recognize it. Now, in a lot of trauma, we already know that you can experience trauma and not quite realize that trauma is happening, and you start to recognize it later. So with moral injury, it's similar to that concept of trauma. The injury can happen at a certain time, but you don't recognize it until later. So there's a separation between the transgression, the event, and when the injury starts to appear to the person. So there is some complexity to this. I just wanted to point that aspect out, especially for those who work in hospice. And this can happen. You can be bedside or start to get to know a patient. We'll just use a patient as example. And you just start to engage with them about, what their life was like or what they did in the military. And you'll notice as they're talking, now that you're aware, when you have more understanding of moral injury, you might realize, oh, maybe they had a moral injury. And you're thinking this to yourself, and you start to see whether you're helping that person realize that or not. That's not my point. But it may not be until someone is towards the end of life that they are recognizing it wasn't just some wartime experience that happened, but that they experienced something that kind of cracked their soul, wounded their soul. And they may only now be able to go into a place of healing and recognizing that that event wasn't just bullets and bombs, but that event was something that made them lose their foundation crumbled, made them sort of confuse their moral ethics. And did I do something right? Did someone else do something right? What is right? What is wrong? They may not recognize that until now. So there's often and usually a separation between the incident and when someone starts to recognize that they have that injury. Because it's not a bloody, oozing little need a band-aid. Although we would like for them to have that care right away when that happens, the recognition is often later. So here's where we can talk a little bit about examples. I've put quite a few up here. We're just going to talk about these events, these transgressions, things that can happen for someone who's in the military. Things that are very obvious: deadly force in combat, which can cause harm or death, especially of civilians. Um, People in the military absolutely many of them feel the weight of killing anyone. If it's an enemy, an identified enemy, or really when someone is attacking you and they are trying to kill you, you're defending yourself and you kill them back. While that is extremely serious, there's a sense of understanding it still fits squarely in that ethical realm of I was defending myself or I was defending my buddy. or I did that because they were about to kill a whole bunch of civilians. But if that is not the case in a lot of the complex types of warfare that we have this century and Vietnam, especially if there is harm or death to civilians, that is a very common cause of moral injury. Now, you don't have to do the killing yourself. You may just be giving orders. So it could be someone who was in charge and it resulted in the death of civilians or a fellow service member. Um, People in authority experience and carry with them what I would call potential moral distress for quite a while. I have military in my family. My husband's in the military. He happened to be pretty high ranking, and this is a very personal story, but I'll just share this. He was making decisions all the time about, he was in theater, making decisions all the time about where people would be deployed to and whether someone is going to be going outside the wire, go to some particular location. And a classmate of mine and a friend of mine was someone who was serving under him. And I was not married to my husband at the time. So I learned this much later. But my husband, in a position of authority, this younger officer was asked to go somewhere else in theater and said, I'd like to go do this to support such and such. And my husband hesitated and said, it's a really dangerous area. I'd rather you not go. Now, these types of decisions are happening all the time during warfare, everywhere. My husband isn't anything special. Neither is this young, he was a lieutenant who was deciding to go, say, I want to go help out there because he had a language specialty that they needed. And he was just going to go for, I think it was about for a month. So this is nothing special. So my husband was like, I really don't want you to go. I need you here, but okay, you're only going to go for a short time. I don't feel good about this. Okay, I'm going to let you go. And that young man was killed a week later while he was in that location. My husband is just like so many other people in authority. And that is not a moral injury. I want to be clear. My husband does not have moral injury from that. I am talking about moral distress. So if this is moral injury, here's moral distress. It's short of that. I just want to mention that people who are giving orders carry around potentially some moral distress the whole time. Like, could I have done something different? Did I do the right thing? Am I really acting on, should I have trusted my gut more? Am I feeling strong in my foundation of the decisions that I'm making? That type of thing. So again, this could be using deadly force. It could be giving orders. Those are things that people commit, or it could be what we call in the church sins of omission, failing to provide aid to an injured person, or failing to report. And I bring this up, it's really important for me to bring this up, failing to report knowledge of a sexual assault or rape. It is so important. On this call, we often have a lot of females here. Females historically in the military have been the victim of horrible sexual assault and rape. Many have not, but it is really important that we keep this in the conversation. And that is an aspect that can cause moral injury for someone. If they knew of or they witnessed, they supported or simply failed to report sexual assault or rape. Because the victim of that sexual assault, the victim of that rape, is affected for the rest of their lives. And if someone knows that, who allowed it to happen in some way or did not report it, carries with them, not only do they know that that victim was affected for the rest of their life, but also that they allowed the perpetrators to not be reprimanded and have a change in the system or change in the human being. So it's really very important for me that that is mentioned. We talk about following orders. It's very common for civilians, lay people, to talk about military people are following orders and the orders may be illegal or immoral, or they were just following orders. That's why they did something. And I think everyone on this call knows that it's far more complex than that. Um, I actually feel it is really rare, very rare in actuality, that someone did something because they just followed orders that were illegal. People who are in the military are thinking, making their own decisions the whole time. It's rare that they're being forced or doing something that is illegal. They are usually doing something that is according to our rules of engagement. Absolutely, according to everything that we've trained for, everything that we've learned. We take that action as a military member, and maybe later we think, oh, that wasn't the right thing. Or something comes to light that we recognize, oh, maybe that was illegal or maybe that was immoral. So I just want to add a little bit of that complexity for everyone to understand. And of course, there are people in the military who eventually just have a change in their fundamental belief about the necessity of war. And that is a very lively conversation to have if anyone is interested in anything about justification of war or necessity of war. I'd be happy to talk about that sometime. Can anyone think of anything else? I think I've been talking a little bit. Can anyone think of anything else in the military, events that can cause moral injury, or have any questions about is something moral injury or not moral injury?
I appreciate what you said about change in belief because I feel like um, even in my lifetime, the way that my grandfather, my father, my peers, and my kids, teenagers view war is different. Um, and
Yeah.
so people's belief system can be impacted by the culture and the culture's viewpoint, I imagine, and then go, oh, wait, what I was okay with as a 19-year-old in 1970 is different than what I'm okay with in my late 70s in
Mhm.
2025. I don't know if I did the math right, but
We're not here for the math, we're here for the heart.
and Giovanna, I appreciated you talking about moral distress, and I also noticed the parallel with healthcare workers there too.
Mm.
Um, we're making decisions all the time around pain control and hospice and palliative care. Was that right? Was it not? I mean, just that was really um, helpful that you described that.
You mentioned the healthcare, so I've gone to the next slide. Please, anyone, please speak up about we're talking about sort of events that can potentially cause moral injury for anyone in the military, and here we have for healthcare or first responders. So if anyone has anything else about the military, you can bring it up now, and I really do mean you can interrupt me. I'm going to go ahead and just speak to some of these bullets about healthcare and first responders. What we're doing here is we're getting an understanding of moral injury. That's what we're doing here to start to get a feeling. And on these slides is what can cause potential moral injury. So we've already talked about decisions that can affect life or death. And sometimes, a lot of times in healthcare, everyone agrees that all the options kind of have a negative outcome. In hospice, that is frankly how a lot of families see it, that no matter what we do, the outcome is death. And that is a negative outcome for a lot of people. So there is this concept that a lot of times in healthcare, it's about minimizing how bad something is, but when it's just laid out bare, all the options are negative. And that's how a lot of people see it. Healthcare personnel are making decisions all the time about life or death, about what to do with an injury. First responders are engaging with civilians all the time. And both healthcare workers and first responders, a lot of times their actions will affect their colleagues. decisions that they make, whether it's life, it may not even be life or death, but the outcome of a treatment or a medication or something like that, and a colleague is witnessing or part of what is happening. Failure to provide aid to an injured person. That also happens a lot on the battlefield with military, and there's crossover between these two groups of people, of course. Witnessing acts of commission or omission by someone else, someone you respect, someone you've trained with, someone whose life you rely upon, and then you see them do something that doesn't quite fit with your core center, doesn't quite fit with that foundation that all of you thought you were on the same page for years, maybe even more than a decade, and your colleague does something and you witness it. That can cause a moral injury in you. We've just experienced the COVID-19 pandemic and encountered all the time choosing between caring for patients and keeping our own families safe. You remember the times, and maybe some of you stayed at a hotel to protect your own family. Some of us were living not with our own family in order to protect our family so that we could serve our patients. And at that time, it was known that the healthcare workers could be infected and succumb to the illness and then never be able to return to their family. So simply choosing to continue working was making that choice between caring for others, which is a deep value for a lot of people, and trying to keep yourself alive for your own family. So a lot of healthcare workers came out with moral injury from the COVID-19 pandemic. And this last one that we have here, we deal with this quite a bit, which is end of life practices that are counter to our own personal beliefs or values. And I'm not just talking about, I'm Christian and someone else may be a Hindi or have different religious values, but actual, I think one of the easiest ones to use as an example is death, assisted death, medically assisted death, medical aid in dying. So they're very strongly held beliefs. Maybe for all of you on this call, you may have a strongly held belief about that. It's often tied to faith. And even if it's not tied to faith, it may just be what someone believes is the right thing to do or not the right thing to do. And so this is a real thing happening while in my state that those aren't choices that are offered. Are there people on this call who have encountered people who have dealt with the realm of medical assistance in dying? Is there anyone who has?
There was quite a few people in the chat that just put yes. And
Yeah.
I would say this might be too broad of a statement, but the majority of hospice providers, unless they are connected to like a Catholic hospital or have a religious kind of rootedness in their their medicine, their healthcare, most of us probably have had patients that have made that choice because if somebody's appropriate for hospice, then they also, if they're have the capacity to make those decisions and choose medical aid and dying, are also potentially appropriate for that. So I know for True, we have supported people in that choice. They can't use their own physicians, those kind of things. There's a lot of law around it, but I would imagine the majority of the partners on this call have had patients in their service that have made those choices to use medical aid in dying.
Then there's a potential that some of you who are watching right now have already been in a place potentially where you permitted someone to do something that transgresses your own ethical values, your own personal beliefs, perhaps your deeply held faith, which is not just a set of rules. And that can cause a moral injury depending on the experience and what makes up that foundation for you. But it is happening quite a bit in America, for quite a few people. And the conversation does not usually attend to this aspect. The conversation usually stays in a place of politics or, oh, well, do you respect that person? Let them make their own choice. I feel that it is brushed off and put at a surface level, and the conversation is cut short instead of thinking, how has this affected other people? So, especially since we are working in end of life care, that's an important one to consider. We're going to move on from here. I do have, how are we doing on time? Oh my gosh, I don't even have time in front of me.
It's 11:54 and this meeting goes 11 to 12:30. So for context, there you go.
Are there any other examples that anybody would like to bring up? Because anything that we're bringing up here, it helps with other people. We will be sharing a version of these slides for later, and I'm also happy to talk further with anyone about any of this. I'm going to skip this next slide. We've gone through a lot of examples already. It's just reflecting on and recognizing that moral injury may have occurred simply by thinking, okay, I experienced this. So what happens if someone has experienced moral injury? What might be some of the symptoms? We know what that bloody knee looks like. We know when we hurt the body, that bloody knee, what it looks like and what happens. So what does it look like when somebody has a moral injury? There are a lot of different symptoms. I have put on this slide the major ones, and I have listed them in priority order. Shame is one of the biggest symptoms that is talked about and seen for people who have moral injury. That deep sense of, I have potentially done something wrong or witnessed something, something has transgressed what I believe is right. And that concept of shame is really a concept of, I no longer belong. I no longer am in the right, or I no longer belong. It's really about losing a sense of belonging. The shame is to not, the shame is to not lose that sense of belonging to the group you belong to. You know, you don't want to do something for fear that you will no longer be part of that group that is so foundational to who you are, whether it's your family, it's your unit, or it's your concept of what it's like to be a Christian. Shame, guilt. We see a lot of depression, even despair, giving up, totally giving up. Of course, there is grief, but it's not just grief for the effect of what had happened, but grief that the entire thing happened at all and that you were somehow part of it, whether you were in commission or omission. Self-condemnation and sometimes leading to self-harm. A lack of, not only a lack of care for the self, but an actual judgment on the self and harsh treatments for the self, not just the invisibly in how someone thinks about themselves, but in what they are doing physically. This can absolutely lead to existential distress and crisis. I mean, that's at the core of what moral injury is. Existential with your faith, with your code of ethics. Anomie is a sociological term, and it is characterized by a breakdown of moral values or standards or social bonds. It's everything that we're talking about. It's a word that really fits very squarely into what can be a symptom of moral injury and commonly is. Anger and outrage, anxiety, substance use disorder, as many people in the mental health world, as well as in the spiritual care world, when dealing with people with substance use disorder, it is highly likely, someone probably knows the percentage, that underlying the substance use disorder is something else that has led to it. And I would just encourage you, as you are working with people with substance use disorder, consider, is there potentially a soul wound in there? Is there potentially some event in their past that created a moral injury? Social problems and trust issues, especially isolation. The person will no longer feel that they really can or should identify with the group they used to identify with, or they're uncertain. They're just uncertain of who am I? Who am I? Am I still a Christian? Am I still a good person? And not being able to talk about it with someone, embarrassed by it, humiliated by how they feel about themselves, even if nobody knows about the incident at all. They can have this feeling of embarrassment and humiliation. And of course, spiritual issues. Difference between PTSD. Some of you may have seen this slide already, and I think it's just really, really helpful. You can see, let's start with PTSD, something that has been attended to and known about, especially this century, the VA and healthcare, and it's just been great how much growth there's been in recognizing PTSD. And on this slide, the way that they categorize PTSD is you're exposed to a life-threatening event. And what can happen, PTSD symptoms are based in fear and they might have paranoia or flashbacks. Of course, there can be nightmares, hypervigilance, startle reflex, memory loss. Think of a lot of physical reactions. Yes, there's a lot of unseen stuff as well, but there's a very physical feeling to it. And it's about experiencing something and reliving it in your body. Let's compare that to moral injury, which is an exposure to this event that is affecting you deeply in here, in a place that is not the physical, in the soul. So PTSD, think of the physical in the brain, and a soul injury, think of conscience and morality and foundational beliefs and who you are. So you'll have grief and shame, regret, alienation, enemy. But the center is where they cross over. So we've been common to deal with PTSD veterans. A lot of those PTSD veterans, maybe some of you have worked with them, they may also have moral injury. And moral injury and PTSD share these symptoms of depression, anxiety, substance use, not sleeping well, anger, nightmares, and potential suicidality. You can refer back to this slide anytime. I'm going to share just a few photos now. We've gotten a bit of an understanding, and we're going to go on to talking a little bit about walking the journey with someone who may have moral injury, how you may participate in someone's healing. But the first thing I want to do as we end this portion in understanding moral injury, I have a few images for you to look at. The shattering of the psyche. I imagine her looking at herself in the mirror, a sense of not being able to look at herself, very down. She is still a beautiful human being. We see the beauty of her, but she does not see it herself. This could be a veteran and how he or she pictures and herself and feels Instead of a PTSD reaction, this is an internal, absolute cannot deal with what is going on. Who am I? Why am I here? What is happening? These are all images from different organizations and online that attend to dealing with moral injury. A fragmenting of the person while he's still trying to figure out maybe who am I? I'm falling apart. I'm not who I thought I was. And here's a soldier that I say is trying to put himself back together. That foundation was shattered. He's trying to put the puzzle pieces back together and make himself whole. He's on the healing journey. So for those of us, for those of you who may want to start walking the journey with people with moral injury, their journey of healing, anyone can do that. It doesn't have to be a therapist, a chaplain. It doesn't have to be even someone that they know. It doesn't have to be a PhD. It doesn't have to be someone who can give them medicine. It doesn't have to be somebody who knows about the military or knows about healthcare. Anyone can help someone to heal. There are there are three pieces that I encourage if you would like to help someone heal. To prepare for that, you need to be strong and sensitive and be willing to walk the distance. So put some images in your head. We're going to go into these in detail a little bit more. So you want to be the strong and sensitive. And in my family, we certainly do joke about some people, usually men, oh, he's the strong but sensitive type. Whatever image might come to your mind, you need to have a depth of strength as well as sensitivity. They need to be together and be willing to walk the distance. It's not a sprint, it's a marathon or an ultra marathon. It can be a lifetime journey. Being strong and sensitive is part of what allows for the truth to come out. It's part of what allows for the truth to be said and to be seen. And you need to be strong and sensitive for yourself to be able to see the truth. Truth is really important in someone who has moral injury. And being willing to walk the distance is about trust, about that person who has the wound being able to trust you. Not only that you are there, but that you will be there. So it's truth and trust are foundational to this. So we're going to go through each one of these. Be strong. You need to be prepared. Why do you need to be strong? What is it about being strong? Of course, this isn't about muscles. I mean, yes, if you were a big, beefy, strong woman, maybe you're an MMA woman, and you imagine you're able to pick up that person and just hold them, hold them, hold them close to you. So they know that you've got them. All right. So when I'm talking about strength, it's internal strength, but that kind of strength is the kind of strength that's going to be able to deal with this wounded person. You need to be able to tolerate other people's intense feelings of shame and guilt and remorse, self-hatred and despair. The kind of strength you need is to be prepared to tolerate that. Be prepared to face truth that cannot be changed. Whatever cause, whatever transgression or event, or whatever they witnessed in the past, that event already happened. There is a truth, whether we know it or not, but there is a truth that that person who has the moral injury, there's a truth that they understand, and that truth cannot be changed. So, as someone who wants to come and walk alongside and help someone, you need to be prepared to face that kind of truth, to be able to face dark realities and complexity and uncertainty. The uncertainty that whatever that truth is, the only version of it you're going to know is the version of the morally injured person. The kind of strength you need to have is to be prepared to handle your own judgments and your own reactions. So you need to be strong enough to be able to deal with whatever comes at you or what you learn, knowing yourself well enough and be strong enough to be able to handle your own types of responses, which could be physical, physiological, spiritual, emotional. It doesn't mean that you have to have no appearance of a response at all. You have to be strong enough to be ready to deal with your own response. So this is about internal work for you as someone who wants to come alongside and help someone heal. I have this movie clip here, and I don't actually have to play it because it'll take a little bit of extra time. But if you're my era, especially if you're military, does anybody know? Oh my gosh, I don't even remember the name of the movie, but Jack Nicholson says, "You can't handle the truth." He's on the stand, and that other famous actor, Tom Cruise, is I think a lawyer or whatever, and he's telling them, did this actually, you need to, and Jack Nicholson says, you can't handle the truth. Someone who's morally injured and recognizes that they may have a moral injury, and they know the event or they know the transgression that occurred, they will often feel to anyone else, you can't handle the truth. I can't, if I were to tell you what actually happened, you wouldn't be able to deal with it. So when I say be someone who's strong, you want to be someone who can say, and you don't have to say it out loud, but you got to be that person who can say, no, I can handle the truth, no matter how dark it is and no matter how difficult it is.
Giovanna, I appreciate that one of the things that you didn't put was be prepared to fix. You said a lot about walk alongside, and there was nothing about fixing the moral injury. And I think one of the things we face in hospice and palliative care are our patients are near the end of life, especially hospice, and we are going to companion them where they are. We're not going to change where they are. So thank you for leaving out the fix. And I
Yes.
think the movie title is A Few Good Men.
Yes. Or a few bad men. Yes, a few good men. So you want to be the strong and sensitive type. So to be sensitive is to listen attentively and deeply. A lot of people in mental health and in palliative hospice home care are good at this. So you will fit perfectly. You know, if you are considering walking alongside someone, yes, you already have some of these skills, which is to listen attentively and deeply and to watch. Watch with care. Watch the person's sort of when they talk, where do they become more quiet? When do they seem to have a more flat affect? Watch as they tell their own story because you may be coming alongside them before they know they have a moral injury. You may be with them when they start to recognize they have a moral injury, or they may have a moral injury that they know is a moral injury, even though they don't call it a moral injury. These aren't terms that people have been using. They know that they have that wound. They know they have a soul wound. They know they have something that has troubled them for their whole lives, especially if we're dealing in hospice, end of life. And when they start to talk about about that aspect of things. Watch how they are speaking to start to see where they become more quiet or where they may have certain pain points or where there might be some sort of aspect of distress. So, watching with care allows you to see in that story where are the points that are the most difficult. Because with every soul wound, there are places where the cut is deepest or deeper. So be attentive and sensitive to those things. Allow for vulnerability. You can work your empathy muscle in your everyday so that when you come to someone who has a moral injury, that muscle is just ready to be there and allow openness, allow vulnerability from the other person, which means you need to show yourself to be vulnerable. Doesn't mean you tell your own story and you talk about yourself, but they have to see that softness and opening in you to allow them to be vulnerable. Be patient, let the story unfold. It may happen in one meeting, it may happen over 3 years of knowing someone. Let the story unfold as opposed to pushing it. I would err on the side of not asking further questions the first time, second time, or third time they bring it up. Allow for them rather than move the story along or moving them along. You think about they're already walking a journey. You want to be next to them. When they start to fall, maybe you pick them back up, but you're not moving them faster down the road. In my own terms. So again, this is Giovanna speaking. God is at work in everyone's life, and God is already working with that person with a moral injury. And we are called to come alongside. And we are not the one in charge. We are not the one who knows everything that's going on. We're meant to be a companion. There's already work being done between God and that person. They are setting the pace. There's already a place that they're going. We are there to support and try to see maybe where it's going. Yes, maybe clear the path, but to be there alongside them. So being silent, if you're going to err on anything, being silent is important. As opposed to, oh, well, when did that happen? Oh, well, how did that make you feel? Oh my gosh, asking more questions or pushing the narrative, especially in the beginning, really important. I'm encouraging, because this is for people I'm speaking to people who may be new to walking with someone with moral injury. And if anything, you can reflect back their words, reflective listening. They say something, if you feel like something needs to be said, you could say, oh, I heard this. So reflecting back what you have heard and be sympathetic to their reality and to their experience. And the emphasis is on their experience. What did they experience? Not, well, what might have actually happened? Oh, well, did anybody else see that happen? Are you sure? Maybe that's not what really happened. For long held or for unattended to soul wounds, unattended to moral injury, it has not been healed at all. It is deep. And whatever that injury is in the mind is what you need to attend to at the moment. So you do not want to, in the beginning, try to figure out, well, what actually did happen at that event? Or, try to go research something that occurred and, oh, that didn't actually happen. Hey, I don't know if you saw this article, but this didn't actually happen. If you ever do that kind of stuff, it is way, way later in the process. So you want to be sympathetic to their reality and experience. So be strong and sensitive and be willing to walk the distance. This is an ultra marathon. All right, we're letting the story unfold, and you want to think it's in their time, not ours, right? Or as a lot of people say, it's in God's time. Well, it's God with that person and what that person can handle. So think it's in their time, not ours. You want to be building trust and confidentiality. Oh, Confidentiality. I cannot emphasize this enough. Don't even tell your spouse. Confidentiality is like, I wanted in big words there. And confidentiality, doesn't just mean, hey, I just want you to know I'm not going to tell anybody this. Confidentiality is all about who you are as a person and how you behave with that person. But I would recommend stating it out loud at some point, very gently and kindly, that if you're dealing with somebody, say, I do want you to know that I am keeping this with me and I am respect so much what you are sharing with me. And anything else you might say, you do want to speak out loud to the concept that you are keeping things confidential. You want to be available to the person. Doesn't have to be 24/7, but just like you are with other people, when it's kind of important, someone might need you. Um, and so be available to them. To walk the distance, you're going to need to be courageous. You never know what's going to come out. It goes back to the truth and the difficulty. At some point in time, you may start to think, wow, this person, they're kind of off their rocker. And I think they're wrong about what they think. And I think I got to get out of here because I don't agree with their view of something. You need to go to someone to get help for them, but it means you need to get help for yourself. So someone who has a moral injury, again, this was about them and their moral injury. And you might start to encounter some things that are difficult for you. You need to take care of your own health. You need to figure out what's right for you. But the concept of going into being with someone with a moral injury is a long distance road. You have to be willing to do that, which means you have to have courage, even if you're hearing things you don't like, or you think, maybe I don't really like this person, or I don't agree with them. Well, you got to be courageous to be able to still face what they're bringing forward and maybe work with someone that you don't like. Actually care about someone and help someone that you don't like or you don't agree with. Once they have started, especially if you get down the road, once they have opened up to you, it's it is it will feel like a betrayal leaving them. And I'm not saying now you have to sign up for this ultra marathon, you're never going to get out of it. You have to keep yourself healthy, all the things that you would normally do. But I'm just saying you need to have courage, even if you start hearing things you don't like to hear that are really hard. Then you maybe need to get some help yourself to be able to have that courage to hear what this person is sharing. Because you may not like it. You may not like what you're hearing. You need to allow for the truth. That's the whole point here. Be courageous to be able to hear the truth from that person's truth, and be a trusted confidant. If you want to help someone heal on this journey, you are a companion. You're not trying to fix them. You're not trying to justify whatever happened. You're not trying to explain away the occurrence. You're not trying to say, well, it's okay. You are a companion. And on this healing journey for that person, it's just two of you. You are that very personal companion. But often for people with a soul wound, you may be the only person that they are talking to. So you represent society, this larger concept of community. You are their first community of coming back into community, of establishing the ability to be in a community with someone else. It doesn't mean you guys have all the same likes or dislikes or exact same ethics or values. This person is practicing being in community with you as you are walking along the path with them. Your kindness, your empathy, your strength, your courage to be with them is healing what has happened to them, which is they have broken away from community in some sense because of this soul wound. So in a way, you are representing society, even if it's just you with that person. You are already starting to give them a sense of, no, another human being is loving you. You can be open. You can talk with us. All of these things allow for the truth to come out. and for that person to start trusting someone, that person with the moral injury can talk about the truth that is so horrible to them, and they can trust that someone's not going to kick them out because of it.
Giovanna, we have about 6 minutes left, so I just wanted to make sure you knew the time.
Thank you so much. We are just finishing up here. So, you are a companion. You represent community that is based in truth and trust. And that leads to healing by this rebuilding of that moral foundation for that person and reconnecting to community. Like if you think of the soldier that was putting the puzzle pieces back in, he's rebuilding his moral foundation. That can be done. And you are the first person of community that they are creating with. The rebuilding of the moral foundation and reconnecting to community are essential for eventual healing for those with moral injury. This is my quote. These have been my quotes. The greatest medicine is God and community. So, for anybody, God and community. And God can be seen as faith or spirituality, something greater than the self. And community is friends, companionship, someone just to do life with. The greatest medicine is God and community. And there are additional medicines. You can see them here. On the spiritual side, there are a lot of things that can be done to support someone as they are healing from a soul wound. And you may be familiar with a lot of these. And then on the spiritual and secular side, they can come to both. There's so many powerful ways. Overall, connecting to community is really important. And there can be types of group therapy. Wilderness therapy is one of my favorite and I find most effective. There are a lot of different healing arts. A lot of things that many of you may already be familiar with can be very helpful for someone with moral injury. And we find that group sessions with a mental health provider paired with or someone in a spiritual arena can be very powerful. And for yourself, if you want to encourage someone to seek some sort of professional resource or help, then I would encourage a chaplain, a mental health professional. Social workers know a lot of resources, and the VA, our favorite. I will leave you with this. Living with moral injury is lonely and dark for the person who is wounded. Are you willing to be a companion? You can help rebuild and reconnect this person to foster healing and to bring light to people who are suffering and need you. So I encourage you to go forth and consider walking the journey with someone who has moral injury. Any questions for me? I'm going to bring my face back up, I think. Are you still with me, Becky?
I'm still with you. Your PowerPoint is now gone and your face is up. It's been up the whole time. But you just probably haven't been able to see it. So thank you so much for this very thorough and applicable training on moral injury. You're getting some applause from Laura Madlin there. Any questions?
I want this to encourage all of you to consider thinking more about moral injury. You have a good, just basic understanding now. And the healing part of this presentation was to encourage you that anyone can help someone that has a moral injury. And reach out to me if you want to talk about anything else, or if you have a small group or a large group that would like to hear. I'm happy to give. This presentation was for you, but any other types of presentation I can always consider. And I do have, this just, will we have access to this training after today to show the chaplains?
Yes, I'm recording the training and then I can distribute it. My question in these last couple of minutes is just since the majority of us are hospice and palliative care connected, and there won't necessarily be this journey towards healing, is there any any advice you have that we could give a volunteer. Many of us are volunteer coordinators, or give a clinician as they companion someone who might be facing the whole of their story and then end up with moral injury in these final months before their end of life. Does that make
Mhm.
sense?
Yes, let me see if I'm answering this. The be strong and sensitive and to be willing to walk the journey. I would still encourage all of those aspects. Someone can look at those and see, okay, just be a little more open. And this idea of moral injury, we use the term moral injury, but it is to see, is someone still hung up on something? A lot of times someone may call it, well, I've sinned in my life. And we do see that a lot with military people that are older generation. So the term they may use is I've done wrong things in my life. And that may be the little crack and the little opening to there may be a moral injury there. So the way of being with someone who has a moral injury and to attend to that is to do just what was in those slides about being strong and being sensitive and allowing for their story to unfold. It is simply someone who is going to, what I would say, love and stay with them and be
Mm.
there and hear their truth and
Mhm.
say, I hear you. That must have been horrible. I'm so sorry. I don't know how you went through that. Something as simple as that, they may have never been, because they might have never told someone about it. So just to be with them. So a lot of people who already work in hospice, volunteers are perfect for this.
Mhm.
To simply be there, let the story unfold, and let them know that they absolutely are someone who they hear their truth, they understand how horrible it is, and there's mature empathy.
Thank you so much, Giovanna. I really appreciate all the time you put into this presentation and this very relevant teaching. It's
You are
12:30. The time
you're
flew by. And I believe that you're going to share the PowerPoint with me, and then I can share it widely, and we can watch some of the videos that you put in there too. If you want to share those links in the email, I can just accompany that in the email I send out. But
sounds good. We'll be in touch.
all right. Thank you.
God bless you
Thank
all.
you so much.